Your doctor writing a prescription for what ails you. A trip down the aisle of your local pharmacy. Pretty common scenes, and for many of us, the answer to our medical concerns. But if you're not careful, what you don't know about your medication can cause a host of other problems. So before you pick up that prescription, pick up some pointers from the expert, pharmacist Paula Henson. First question. Your doctor and pharmacist have complete records of all the medication you've taken or are currently taking. True or false? False. While doctors and pharmacists do their best to keep up-to-date records, you are the last line of defense to ensure they have an accurate understanding of your complete drug history.
Your drug history includes not only prescription medications, but any herbal or vitamin products, and also any over-the-counter medications that the patient may purchase if you visit multiple physicians or multiple pharmacies. You should be able to give each of those sites your complete drug history.
Your pharmacist can lend a hand in compiling that history. Just ask, and he or she will get you a printout of the medications you've received from the pharmacy. Working up a complete drug history plays a big part in avoiding negative drug interaction.
Aspirin can cause the blood to be anticoagulated. Aspirin can either affect the patient's blood flow or coagulation, or it can displace other medications, which could lead to a toxic or overdose situation with those drugs. Another major drug interaction that involves young females is taking an antibiotic along with oral contraceptives. Many women have been surprised to find out that they were pregnant after taking that drug combination because the adequacy of the oral contraceptive fails.
Next question. If your prescription calls for a certain amount of medication to be taken over a certain period of time, you can quit any time you feel better. True or false? False.
We may have a 10-day supply. We take it over 4 days, then stop taking antibiotics, and that's causing a real problem with sensitivity to antibiotics in our country.
All right, try this one. Taking a certain medication in the past without having an allergic reaction to it does not guarantee the same result in the future. True or false? That's true.
Patients of any age can develop an allergy even to medications that they have taken in the past. If you're having a minor reaction, then you can call your physician, but no one should tolerate shortness of breath or other chest pain. You need to seek emergency assistance.
So, how are you doing so far? Increasing your pharmacy IQ can be challenging, but in the long run it's worth it, especially for parents who face even greater challenges when it comes to mind over medicine.
Don't just assume that the prescription that's being written by the doctor and the pharmacist that is carried out the way it should be. Ask questions.
Those questions are a lifeline for Patrice. As a wife and mother, she has her hands full keeping up with her family's medical history. Which brings us to our next question, and it's for parents. Your children come down with the same symptoms, so it's all right to treat them with the same medication. True or false? That's false.
Sometimes that's done to save money, but you need to make sure that you have the correct dosing information. Many of the over-the-counter medications do not list appropriate doses or any doses at all for children less than 3 years old. So it's important to know what your particular pediatrician recommends.
On the subject of dosage, when taking a teaspoon of medicine, it's not always safe to use a teaspoon from your silverware drawer. True or false? That's true.
In most households, a teaspoon may range from 3 milliliters to 10 milliliters. When a physician writes a prescription, take 1 teaspoonful, he means 5 milliliters. It's important that you have a standardized dosing tool.
Patrice has her measuring spoon in place, but let's just see if her pharmacy IQ will tell her how to use it.
I'm not a doctor or anything, but I think 5 milliliters equals 1 teaspoon. So that's something else you have to remember.
Good job, Patrice. By learning about her family's medication, by paying close attention to those expiration dates, and by communicating with her pharmacist and doctor, Patrice has achieved a pharmacy IQ that's off the charts. Follow Patrice's example, and yours will be too. For Smart Medicine, I'm Rod Starnes.
Joining me now is pharmacist Kent Stoneking. Dr. Stoneking, thanks so much for joining us.
Thank you, Ken. Pleasure to be here.
What are some of the medical mistakes that consumers often make?
People don't pay attention oftentimes, and it's a reflection of human nature. Directions are clearly put on the label. They don't follow them. Take it with food, take it on an empty stomach, take it at bedtime. People forget, but the information is their best friend. The auxiliary labels that we put on the bottle don't take within an hour of milk. It's to help the medication work as best as it possibly can. The other thing that patients will often do, and it's for the sake of convenience or cost, but they will go to multiple pharmacies. They'll go to multiple doctors. Sometimes that's necessary, but many times it could be avoided. And the bottom line thing that people need to understand is the fewer medical practitioners, physicians, pharmacists, whatever, the fewer people that are in that picture, the better care they can receive because it's streamlined.
What are some of the challenges you face in serving customers?
Communication is one of the biggest. We have a multicultural, very diverse community here, and people often joke about the fact that we're separated by a common language. But there are some things that we can really take control of. The pharmacy where I work, we prohibit the use of cell phones. We just tell them cell phones disrupt our work. We're dealing with medications, and it is easy to get distracted and to make a mistake.
Tell me about herbal supplements and how they can affect medication.
Many people underestimate the power of herbal supplements. Just because it comes in a bottle that is nice and earth tone and says all natural does not mean that it's healthy or good for you. Many herbal supplements can negate the effect of prescription medications, or they can augment and increase the effect of a prescription medication to the point where that would be dangerous. Some examples would be ephedra. Ephedra has been in the news quite a bit lately. Recently, a judge out in Utah partially struck down the FDA ban on ephedra, but you'll begin to see ephedra-containing products coming back to the market, at least those that contain 10 milligrams or less. Ephedra increases heart rate, blood pressure. People that are on blood pressure medication, people that have diabetes and kidney disease don't need to be taking ephedra.
Doctor, thanks so much for joining us. It's wonderful. Good.